Some men tell us in the group, I feel great on 200 milligrams a week. I feel even better on 250 milligrams a week. And I did all my blood work. It's fine. It's completely okay. So my levels are even 1700 total nanograms per deciliter. So is that unhealthy long term? Can we sustain that? And actually, how to know if this test dose is too high?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Okay. As with most things in the real world, there's going to be two schools of thought on this here. You're going to have the medical response and you're going to have the legal response. From a litigation standpoint, prescribers are accountable and responsible for the treatment and medication that they provide you. And if you fail to adhere, naturally, they're going to want to pull back or they're going to want to cut you off. If you are adhering and they're prescribing you a dose that puts you at supraphysiological levels, there's nothing particularly wrong with that because that is strictly considered, off-label use. Can someone prescribe you testosterone and document that this is for bodybuilding purposes or putting you in a competitive mode? No, absolutely not, because those are not medically recognized indications for use of this medicine. Can they document that this is a level where you find symptom resolution and you feel well and everything is great, and then you attach some labs every now and then and have a conversation and make sure that they're not harming you in the process? Yes, they can. The problem here is that this industry is so heavily scrutinized because of all of the media bias and all the nonsense going on with steroids and the social stigmas of the public, that when something does happen, any negative outcome for a patient, the first thing that they're going to look at when they go down the list of medications or medical histories, they're going to say, this guy's taking an anabolic androgen that is quote unquote unsafe or risk adverse, or they're going to go back to studies from the 90s or athletes or super physiological abusive doses. And they're going to say this is no good because the average male, again, is going to be in a range of these, and we have a whole video on lab ranges which are totally flawed, but they're going to go back to standards of care and they're going to say, you're 50 years old, you should be at 500. Why are you at 1700? And while we know that so long as the individual handles it well and the CBC looks good and the metabolic panel looks good and the kidneys and liver look good and prostate and everything else looks good and the guy is healthy otherwise and he feels well, there really isn't a detrimental risk that we are aware of. Now, again, we don't know for sure because we would have to study guys who are at that level for 30 years, and we just don't have that kind of data because most of the guys who have run these doses for 30 years are retired bodybuilders, and I can guarantee you that they were not just on 250 milligrams of testosterone. There was 17 other ancillary androgens involved, and there may be recreational drugs and alcohol and everything else that comes with that lifestyle. So to have a true study on men who are at supraphysiological levels for an extended period of time, the true answer is we just don't know. Because you can go out and get hit by a bus and they're going to put a finger on your medicine and say, you died of testosterone overdose, because you don't really overdose on hormones, but this is just how it goes. So the legal implications for a provider to put you on 250, 300, 400 milligrams a week, even if you feel great and there are no adverse reactions, is probably a little too great for them to bear. And again, if they are doing this consistently, then I would start to question their motives. I mean, are they there to just kind of keep you on the books and sell you product, or are they really concerned with your health? Now, with that said, I have seen guys who maybe have abused steroids for 20 years and they're just so desensitized to their androgen that if you put them on 250 a week, they're just going to feel low. They're not themselves. And I've seen a handful of guys who do need 300 milligrams a week, even to achieve 1,000 nanograms per deciliter. And some guys do feel better at 15, 1700. And again, if there's no adverse reactions, great. But those are the outliers. That is not the norm. Those are the guys that are going to be the outliers. And I know that if we go out there and justify this, everyone's going to jump up and say, well, maybe I'm the outlier. Maybe I should try it. So before you run out and go ahead and double your doses, understand that more is not always better. Okay, you may feel your best at 150 milligrams a week or 140 a week at 900 or 1,000 or 1,200 nanograms with a free T of 27 or 30 or 35 nanograms per deciliter. And the good thing is you can stay there and you can justify this, and your provider can justify this, and you can have longevity and you can really feel well. Now, again, when we're discussing performance enhancement and bodybuilding and things of the sort, yes, there are going to be differences, but can you live at that level for 30 years? The answer is we truly don't know. So I'm not going to sit here and pretend that it's safe, and I'm not going to tell you that it's going to kill you. the true answer is we don't know. If you'd like to be that guinea pig, by all means, come back, in 2050 and let us know how it worked out. But at the end of the day, understand more is not always better. And people always like to look at guys, that are putting in all the efforts in the gym and they're eating well and they're sleeping and they're managing stress and they're doing everything else. And oh, by the way, he's taking 250 milligrams of testosterone and I want to look like him. Understand the amount of years and time and effort and even genetics that goes into that. Testosterone will be like, if I had a list of like 1 to 10, testosterone is like number 8 on that list of priorities. I'm not trying to oversimplify or take away credit from what an optimal hormone level can do for an individual. But believe me when I tell you, you could take all the tea in the world, and I know everyone's going to jump down now and say, oh, studies show that you can lay on the couch and build muscle. Look, I don't care. If you're not hitting the gym and you're not eating the right way and you're not training the right way, go ahead, lay on the couch and gain a pound a year and, have a little recomp and go ahead and point at the study. You need to bust your ass in the gym the right way. You need to eat the right way. And 98% of the men that I have coached or spoken to simply do not do this. So they think that an extra 50 milligrams a week is going to give them the body they want. Please just focus on the essentials and stop trying to hear what you want to hear. I've been there. I've done it with thousands of guys and girls. It is really down to your work ethic and your diet. And putting an extra 50 milligrams a week of androgens into your body is not going to do the job. So I really dislike this topic a lot because guys are always trying to find new ways to ask, what if I increase here? Is this safe? What if I do that? Can I justify this? Please just focus on the essentials and don't worry about 250 milligrams a week.
Great.
And now go watch one of these videos to learn a ton more about TRT and hormone optimization.